Today we're going to talk about placement of an OCO implant. This is the thin pilot drill making the first osteotomy, keeping the drill in line with the long axis of those teeth, and I'm drilling to the depth of the endostop. That's going to stop the drill. Now, where do you have to worry about depth? There's no problem engaging the floor of the sinus. The place you have to worry about depth is the posterior mandible, the inferior alveolar nerve up to the mental foramen. So you can see this pilot drill pretty parallel to the roots of the adjacent teeth. And so I'm using that thin pilot drill first. Then we're going to come back with these pilot drills, and these pilot drills have shoulders. I really like shoulders on drills because it limits the depth of the drill going into the bone. See, this is 16 millimeters from the shoulder to the tip of the drill. I'm just going to go right back in to that original pilot drill hole, staying parallel to the adjacent teeth and trying to keep the drill at a midpoint between those two teeth. Okay, then I'm going to the 2.8, and then this is the 16. Shoulder is going to stop on the soft tissue right here. So the part through the soft tissue into the bone is going to be 16 millimeters. So we're just widening the osteotomy. And the shoulder, see, stops the implant at 16 millimeters. 2 millimeters through the soft tissue and 14 millimeters in the bone. So that's just about perfect. Final implant drill was 2.8 times 16. 2 millimeters of soft tissue, 14 millimeters in the bone. And the final implant size is 4.0 times 14. Remember, you want the implant to be wider than the drill, and that'll be a nice snug fit. So we're screwing this straight through the soft tissue into the osteotomy. And I'm watching as I torque it, I'm always watching the alignment. I want to be aligned, especially with this bicuspid, when I'm putting the implant to place. And so ideally, I would like the coronal part of the implant, the top of the implant, be about at the level of the alveolar crest, about at the level of the bone. Torquing it to 35 Newton centimeters. Here's the implant. Then the healing abutment goes through the tissue, so the emergence profile is going to develop while the bone osseointegrates with the implant for 3 months. I like to leave it for 3 months. That's the dental minute. These techniques work, and they work every time.